Sun, sea and sand, that's what brings most to Cyprus, but for some, it's something else. Paul's long COVID symptoms brought him here. In this clinic in Larnaca, he is doing something he can't do at home. It may look like he's giving his blood. In fact, he's getting an experimental blood washing treatment that desperate long COVID sufferers are turning to.
My life has fallen apart. For about 2 years I've been a hermit. I've been a burden on my family and friends, and I was suffering with headaches and brain fog.
This is Paul's 7th session of apheresis. It's a conventional but invasive procedure that's being used in an unproven way for long COVID. And it's not cheap, around £1,500 a time, but for Paul, it's worth it.
After each treatment, I have experienced a small improvement, and the incremental improvement, is quite big now.
And Paul isn't the only one using this treatment. An investigation by ITV News and the British Medical Journal has found that he's one of around 120 people with long COVID who have made the pilgrimage to Cyprus for it. Thousands more people have spent life-changing amounts, some even crowdfunding, to go to these clinics, including in Germany and Switzerland.
Doctors wouldn't prescribe me anything. They were like, take an aspirin, go back on the couch, I'll see you in a year, you'll be fine, it's all in your head.
Businessman Marcus Klotz set up the Long COVID Centre in Cyprus after suffering from it himself and trying a variety of drugs and diets before he came across apheresis.
We had people that came in a wheelchair and are now skiing, yes, but we also had people where it didn't work, and anything in the middle. But I would say the majority gets a big part of their life back.
The centre also prescribes blood thinners called anticoagulants. The drugs can cause serious bleeds and they're not given on the NHS for long COVID, so people fly out there to get them.
I'm also taking some anticoagulant drugs as well.
Did the clinic prescribe those drugs?
Yes, they did. Yes, that's right.
Has you got some little bruises, you say?
Yes, I do have bruises because my blood's quite a lot thinner than it was.
So there's a theory here that people with long COVID have tiny little clots in their blood, so-called microclots. The idea is that these tiny clots starve the body of oxygen, which trigger the long COVID symptoms such as brain fog and fatigue. And then this apheresis filtering treatment removes the clots from the blood, and the blood thinners stop them forming in the first place. But some experts are sceptical.
The problem is there's not enough science. How would the microclots cause fatigue? That's the issue for me, and a lot of the other symptoms that people with long COVID have, and they're very real, but I can't see the link between finding those particular things in the blood being a cause of long COVID.
This is the woman behind it, Dr. Beate Jäger, seen here on German TV. She's been doing apheresis for years and has pioneered its use for long COVID, which is legally allowed as long as patients are informed that it's experimental. We asked Dr. Jäger to take part in an on-camera interview to discuss the lack of robust scientific evidence for her long COVID treatments, but she declined, saying she's too busy saving lives and that she's trying to do clinical trials, but they cost millions. Our investigation also spoke to the doctors regulator there, who said they've not received any complaints, but will investigate if they do.
If apheresis works, then we'd want lots of clinics to offer apheresis across the world. And in order to do that, they have to have the evidence available in a scientific format. And we don't have that at the moment.
I was just really struggling to exist. It was almost like survival mode.
Chris is one of those who travelled to a clinic in Germany, a different one to Dr. Jäger's, after reading positive reviews for apheresis on patient forums, including claims of 80% success rates.
It's almost like an instant miracle cure, and I'm 100% convinced that it's not a solution for long COVID. It's the long-term effects and the long-term success stories that aren't as forthcoming as the immediate euphoric sort of wins that people post on their social media walls.
For clinicians like Dr. Laura McWhirter, who runs an NHS long COVID clinic in Edinburgh, stories like those of Chris and Paul are concerning.
I can understand that people are really desperate. I think desperate people are also a bit vulnerable to, taking risks on treatments that might not be likely to be successful, or that might lose a lot of money, they might come to harm.
Medicine is littered with examples of treatments that seem like a good idea but turned out not to work, or even harmful when proper studies were done. You are offering a treatment that doesn't have clinical trials behind it.
You cannot leave them alone for 5 or 10 years on their own with an aspirin on their couch. This is not just a little flu, it's a severe illness.
The Department of Health told us that it strongly advises people to only access new treatments through regulated clinical trials for their safety. For people with long COVID, that means more waiting and suffering. Deborah Cohen, ITV News.